Okay, in this practice also we have diagnostic test as well. We can ultrasound almost any part of the body. For abdominal pain, if we suspect gallbladder disease, we can do an ultrasound for the gallbladder. If we suspect a kidney stone, we can ultrasound the kidneys. And we can ultrasound a lump at least to reassure a patient that it's nothing serious.
I take ultrasound of the abdomen to make sure that the liver's functioning, gallbladder, pancreas. There's nothing abnormal in the abdomen. Same thing for the thyroid. Vascular, I look for clots in the legs and in the arms. Arterials, I'll check the arterial flow in the carotid arteries in the legs and in the arms. It's convenient. They come and see the doctor. If the doctor orders anything, they can have those tests done usually the same day. Whether it be ultrasound of the heart or of any other body parts, we're usually able to fit the patient in, and that way it's convenient, a one-stop shop for the patient.
We can do echocardiograms here, which are imaging of the heart, which are a great study to look at the heart, to see how well it's pumping, look at the valves. Gives us an idea if anybody has a problem where their heart's not pumping well, where the valves are have a problem such as a leakage. If we hear a heart murmur, is it actually a valve problem? How serious is it? These x-rays or images are actually interpreted by a cardiologist that reads them, and I also read the films too.
We're able to see if the function of the heart is good or bad. We're able to use a color Doppler flow, which allows us to watch the blood, tracking the blood flow through the heart muscle itself. And we're also, since we can see the valves of the heart, we can see whether or not the valves open or close properly. Once we complete the examination itself, the turnaround time is quickly, so we can get the results back to the patient as soon as possible.
We have access to a DEXA machine that's high quality, high caliber, similar to what's used in rheumatologist offices and also in hospital settings. It's an actual DEXA scan rather of the spine and the hips, rather than wrist or the foot, which are not as accurate.
We have a bone density program most newly here, and it's basically for the diagnosis and study of osteoporosis or low bone density. What we've done here is combine various areas of study in healthcare, simple exams in one format for a practice that wants to be multi-specialty, multi-function.
We encourage patients to come in. Many times our diabetics and hypertensive patients and the patients with obesity, we encourage them to come in on a regular basis. That also helps with their compliance, with their sticking to their medication. We can see if there's any problems, if they have problems with the medications. Sometimes it's something as basic as the cost. They won't take the medication because the cost is an issue, and there's something else we can try. The only way we know is if the patients will come back in. We can monitor their lab work more often if they actually come in, which helps, and we can monitor weight. So I think having patients come back in and just checking on them on a more regular, periodic basis helps with their health in general.
We found Dr. LoCicero through some friends of ours who were neighbors of her families. My first impression of Dr. LoCicero was that she was kind, and I liked the fact that she was a woman. At my age, I had thought that I would like to see a female doctor, that she might be more in tune with the problems of women of my age. It's been excellent. She reminds me of the doctors we had when I was a child. They were more like a friend of the family, and they knew you. They knew everything about you, and they treated you as a whole, not just a symptom. She has so many facets to her business. She has a good team. They're all very friendly, very helpful. Very pleased with it.
LoCicer Medical Group is better because they spend more time with their patients. They seem to care more about their patients. They take the extra mile to hear everything that everybody has to say. The access to all of the machines and testing in one facility is, one, they don't have to run around, and two, they know a lot quicker the results of the test. If there's a problem, they can get to it quicker. Their results come back a lot faster.
Just this week, a very close friend of mine has started to see Dr. LoCicero because I recommended her. And she was just in this week and began talking with her, and Dr. LoCicero has started her campaign of different tests and things for her. And I spoke with her yesterday, and she said that she loved her and that she was so excited about finding a doctor that was going to address all of the issues that she had.